Hi everyone, this is Neil Writers here, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with occluding earwax in their left ear. And I'm just using our medium-sized specular to dilate and straighten open the entrance of the ear. And I initially proceeded using microsuction, and I'm using the right ear canal suction tip. It's the 14 gauge, which is the equivalent to the normal Zollner suction probe that we typically use in the UK for oral microsuction. It was quite a dense plug of wax. It was adhered to the posterior canal wall, so the back section near the entrance, so laterally. I've just instilled some medical grade olive oil spray just to see if I can just soften the surface so I can get a better suction grip, and also to see if it allows me to elevate this and peel this off the lateral posterior canal wall. So I'm just trying to lift up and to the left. You can see it's coming away. And now I'm going to the floor of the ear canal. I'm giving it a little wriggle, and I think I'm going to be lifting it up, or I'm going to the back just to separate some of the skin adhesions. You can see it's now mobilized, but I suspect there's a few more skin adhesions at the tail end of this plug, which is preventing it from coming forwards. It's quite a sizable piece. I have taken a still image. And I'm just trying to rock it left and right, up and down, and at the same time come forwards, but it's just not budging. You can see it's moving around, it's wriggling around, but it's not coming towards the entrance. So I am going to revert to the correct. I could have used the ear hook as well, but I just wanted a bit more surface area, which you can get with the correct. And there's a little gap at the top. So we're just going to feed the correct through, and I'm just rolling it forwards initially. So at this stage, I'm not actually in and behind, but now I am, and I'm going to leverage this out. Now, it may have come away with microsuction, but it would have taken a bit longer, I suspect. I may have had to use a bit more oil. So it's just come away nicely with the correct. You can see the tail end is quite dark, and there's a lot of skin adhesions to that, and you'll see that on the still image. So I suspect that skin at the tail end was still attached to the canal wall, and the front part was mobilized, but the tail end was still adhered to the ear canal. Just going to visualize the eardrum. All looks well. And then the right side is, you can see the eardrum, it's nice and healthy, but there was a bit of lateral non-occluding wax just adjacent to the second bend, so about 0.8, about 8 millimeters into the ear canal. So I'm just going to correct this out for the patient. I didn't charge them there. So I'm just gently coming away. You can see there's a bit of skin there as well. So that's coming away nicely. And job's done. So you're going to see that plug, and the section to the top where you got all that skin adhesions, that was the tail end. So we managed to prise that out the ear. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.